Hey everyone, welcome back to our channel, where we break down important health topics that matter to you. Today, we're diving into a critical issue: the rising incidence of heart attacks among young adults. Heart attacks aren't just a concern for older folks anymore. More and more young adults are facing this life-threatening condition. In this video, we'll explore the biggest factors behind this alarming trend and what you can do to protect your heart. Stay tuned. Number 1. Unhealthy lifestyle habits. One of the most significant contributors to the increasing rates of heart attacks among younger adults is the prevalence of unhealthy lifestyle habits. These habits include a sedentary lifestyle, poor dietary choices, and rising obesity rates. Physical activity is essential for maintaining cardiovascular health. Regular exercise helps to control weight, reduce blood pressure, improve cholesterol levels, and boost overall heart health. However, many young adults lead increasingly sedentary lives, largely due to the rise of digital entertainment and desk-bound jobs. According to the World Health Organization, physical inactivity is one of the leading risk factors for global mortality and is estimated to be the principal cause for approximately 21 to 25% of breast and colon cancers, 27% of diabetes, and approximately 30% of ischemic heart disease. Diet also plays a crucial role in heart health. The modern diet, particularly in developed countries, is often rich in processed foods, sugars, and unhealthy fats. Fast food, sugary beverages, and snacks high in sodium and trans fats are more accessible than ever. These dietary choices contribute to obesity, hypertension, and high cholesterol, all of which are significant risk factors for heart disease. A study published in the Journal of the American College of Cardiology found that poor dietary habits are responsible for nearly half of all cardiometabolic deaths in the United States. Another growing problem is the obesity among young adults, driven by poor diet and physical inactivity. The Centers for Disease Control and Prevention, CDC, reports that obesity rates have more than tripled in the past 50 years among children and adolescents. Obesity is closely linked to various cardiovascular risk factors, including high blood pressure, high cholesterol, and type 2 diabetes. Each of these conditions increases the risk of a heart attack. Moreover, visceral fat, which surrounds the internal organs, is particularly harmful and has been linked to increased inflammation and insulin resistance. Number 2. Smoking and substance abuse. While smoking rates have declined overall, the decrease has not been as pronounced among younger populations. Additionally, the use of other substances, such as vaping and recreational drugs, is complicating the landscape of cardiovascular health in young adults. Smoking remains one of the leading causes of heart disease. It damages the lining of the arteries, reduces the amount of oxygen in the blood, and increases blood pressure and heart rate. Despite public health efforts to reduce smoking rates, many young adults continue to smoke. The National Health Interview Survey found that approximately 14% of adults aged 18 to 24 were current smokers in 2018. Vaping has emerged as a popular alternative to smoking, particularly among younger individuals. While vaping is often marketed as a safer alternative to smoking, its long-term health effects are not yet fully understood. However, emerging evidence suggests that vaping can still have negative cardiovascular effects. A study published in the European Heart Journal found that vaping can cause significant increases in heart rate and arterial stiffness, which are risk factors for heart disease. Recreational drug use, particularly cocaine and marijuana, has been linked to an increased risk of heart attacks in young adults. Cocaine use can cause acute increases in heart rate and blood pressure, leading to a higher risk of heart attack. Marijuana use has also been associated with cardiovascular complications. A study published in the Journal of the American College of Cardiology found that marijuana use was associated with a higher risk of stroke and heart failure. Number 3. Underlying conditions. Young adults may also have underlying conditions that predispose them to heart attacks, even if they appear healthy. These conditions can include undiagnosed high blood pressure, abnormal cholesterol levels, and genetic predispositions. High blood pressure, or hypertension, is often called the silent killer because it typically has no symptoms until significant damage has occurred. Undiagnosed and untreated high blood pressure can lead to atherosclerosis, hardening of the arteries, which significantly increases the risk of a heart attack. According to the American Heart Association, about 46% of adults in the United States have high blood pressure, many of whom are unaware of their condition. Abnormal cholesterol levels, particularly high levels of low-density lipoprotein, LDL cholesterol, can lead to the buildup of plaque in the arteries. This condition, known as atherosclerosis, can restrict blood flow to the heart and increase the risk of a heart attack. Routine screening for cholesterol levels is essential for early detection and management. Genetics play a significant role in heart disease. Conditions such as familial hypercholesterolemia, a genetic disorder characterized by high cholesterol levels, and cardiomyopathy, a disease of the heart muscle, can increase the risk of heart attacks in young adults. Family history is a critical factor, and individuals with a family history of heart disease should be vigilant about their heart health. Number 4. Delayed diagnosis. Another factor contributing to the rise in heart attacks among younger adults is delayed diagnosis. Symptoms of a heart attack can be easily mistaken for other, less serious conditions, particularly in younger individuals who may not expect to have heart problems. Younger adults may experience atypical symptoms of a heart attack, such as shortness of breath, fatigue, or pain in areas other than the chest, e.g., the arms, back, or jaw. These symptoms can be misinterpreted as stress, anxiety, or other non-cardiac issues. As a result, young adults may delay seeking medical attention, which can worsen the outcome. There is a common misconception that heart disease only affects older adults. This belief can lead young individuals to dismiss or underestimate their symptoms. Education and awareness campaigns are needed to inform young adults about the risks and symptoms of heart disease. Routine health screenings, such as blood pressure and cholesterol checks, are essential for early detection of cardiovascular risk factors. However, young adults are less likely to undergo regular health screenings compared to older adults. Encouraging routine checkups and promoting the importance of cardiovascular health from a young age can help address this issue. In conclusion, rise in heart attacks among younger adults is a multifaceted issue driven by a combination of unhealthy lifestyle habits, smoking, and substance abuse, underlying conditions, and delayed diagnosis. Addressing this trend requires a comprehensive approach that includes public health initiatives, education, and individual lifestyle changes. Public health campaigns should focus on promoting physical activity, healthy eating, and smoking cessation. Schools and communities can play a vital role in providing education and resources to support these efforts. Healthcare providers should emphasize the importance of routine health screenings and educate patients about the symptoms of heart disease, regardless of age. On an individual level, young adults should be proactive about their heart health. This includes adopting a healthy lifestyle, being aware of their family medical history, and seeking medical advice when experiencing symptoms that could indicate a heart problem. While the increasing incidence of heart attacks in younger adults is concerning, it is not an insurmountable problem. With concerted efforts from both public health authorities and individuals, it is possible to reverse this trend and improve cardiovascular health for future generations. Thanks for watching. If you found this video helpful, give it a thumbs up and hit that subscribe button for more health insights. Remember, taking care of your heart starts with informed choices. Stay healthy, stay informed, and we'll see you in the next video.